Environment check. Here's my ID. My name is Wen Jingshi. I'm going to start my assessment. Hello, my name is Wen Jing. I'm a current nurse. What brought you come to the hospital?
I have chest pain and gastric pain.
Vital check blood pressure is 167 over 100 is elevated, blood pressure is abnormal. Heart rate is 105 is regular, is abnormal, is tachycardia. And respiratory rate is 20 is normal, and temperature is 37 is normal. Based on the PQST, patient complaint of the upper abdominal pain is 8 out of 10, and the upper chest pain is 5 out of 10, and related to the shoulder, and start from 8 o'clock early morning and getting worse after breakfast. It consists of pain. The patient took medication, aspirin, but that doesn't work for her. The patient, do you have any short of breath?
No.
Any palpitation?
No.
Any nausea, vomiting?
No. Yes, I'm feeling nauseous and vomiting once.
Any edema noticed?
No.
Do you feel any irregular heartbeat?
No, but I think it's beating fast now.
Did you take any pill?
Yeah, for my blood pressure and cholesterol.
Okay. The patient looks somewhat diaphoretic, and there's no edema, no cyanosis, no behavior notice, and patients do not have any dyspnea with activity. Would you lie down? Can you lie down? In the back, to the gun, there's no position notice. Okay, you turn your head to the left. There's no obvious jugular venous distension notice. I'm going to check the pulse. Cardiac pulse, brachial pulse, radial pulse, Douglas pedis pulse. All pulses are palpable, equal bilateral 2+, and the capillary fill within 2 seconds. I'm going to hear the S1, S2, and murmur sound. First, I'm going to S1 and the S2 sound with the diaphragm. The left marking is ankle fluids and turn to the second intercostal space, and the right, here's the aortic. S2 louder than S1. At second intercostal space, to the left, pulmonic. S2 louder than S1. Third intercostal space, Erb's point, S1 is equal to S2. The fourth intercostal space, tricuspid area, S1 is louder than S2. And the fifth intercostal space, cross to the left mid-clavicle line, here the mitral valve area, S1 is louder than S2. And I'm gonna use the bell to hear the murmur sound for the same locations. Aortic, no murmur sound. Pulmonic, no murmur sound. Erb's point, no murmur sound. Tricuspid, no murmur sound. Mitral valve area, no murmur sound heard. The normal sound should be swishing and whooshing. And the apical pulse, we can still check the apical pulse if the peripheral pulse is hard to assess. Now I'm going to assess the abdominal. Okay, leave the gun, lie in the back. There's no bruising, no jaundice, and no lesions, rashes. There's no strain notice, scalp notice. There's no scalp noticed. And the quarter is flat, symmetrical, umbilicus is midline. And there's no lumps noticed. I'm going to hear the bowel sound by diaphragm from lower right quadrant and clockwise. The lower right quadrant, appendix here, the upper right quadrant, the liver is here, the left upper quadrant, spleen is here, and the lower right left quadrant. The descending colon is here. There's the bubble. I can hear the bubble and the gurgle sound for all 4 quadrants. Now I'm gonna to do the percussion from the lower right quadrant, far from the pain, counter clockwise. Timpani sound heard. The left lower quadrant, timpani heard. The upper left quadrant, dial sound. The right upper quadrant, dial sound. I'm going to palpation. Use my 3 fingers, 1 centimeter depression, and rotary motion from the lower right quadrant, far from pain, counter clockwise. I'm going to check the patient's face to see whether there is pain here. I can see the patient face shows pain to the left and the right upper quadrant. Okay, so the patient Miss Feng, 63 years old, came to the hospital with complaint of the abdominal pain, 8 out of 10, and chest pain, 5 out of 10. It's getting worse with the expiration, and the patient has type 2 diabetes and hypertension, and the patient vitals shows elevated blood pressure, 67 or 100, and slightly tachy is 105, regular rhythm, and temperature, there's no fever, 37, and the respiratory rate is normal, 20. There is no cyanosis, there's no edema, no JVD, and all pauses are, we can feel all the pauses, and the abdominal assessment is normal. For the comfort, the further assessment is required to determine the abdominal and chest pain, such as ECG and blood work, including the troponin, CKMB, electrolytes, and CBC. The patient, for the comfort, are going to provide the oxygen and to provide the quiet environment. I also going to ask for the medication for the pain meds to control the pain. The patient is possibly experiencing the cardiac events such as acute coronary syndrome. The two nursing interventions, the first one, I'm going to ask for a doctor for the medication such as nitroglycerin or morphine to control the pain. Because patient has elevated blood pressure and heart rate, is possible trigger back pain. The second, I'm going to ask for a doctor to whether the patient need any medication to control the hypertension and the elevated heart rate, because patient take pill already, but and had medical history the hypertension, but the blood pressure is still high. For the two order expected, the first one is ECG, because patient is possible experiencing the acute coronary syndrome, and the ECG can diagnose the cardiac event such as ST changes. The second one is blood work, including troponin, CKMB, electrolytes, CBC, and the liver function, which can help to assessing for the sign of ischemia and infection. Thanks.